A day of recovery, a day of x-rays, a day to play, and more than anything, a day of waiting. Expecting the diagnosis at 12 noon, every minute that ticked after seemed like an eternity. It wasn't until 5:30 p.m. that Dr. Afifi and Dr. Druzgal entered the room and gave the news.
Go get the ball, let's do some bowling.
No, the bear.
Ready.
There was some kind of emergency and they had to leave quickly. I had stepped out just for a moment and missed their visit. When I returned to the room, I could see the tears in my wife's eyes. They looked like tears of joy rather than sadness. I immediately asked, APML? Unable to respond vocally, she nodded in the affirmative. You would never see someone so happy to have his or her son be diagnosed with cancer. The doctor said in not so many words, if you're gonna get cancer, this is the one to get. However, up until 18 years ago, this type of leukemia was 100% fatal, until Eastern medicine mixed with Western cancer treatments proved to be a statue in the history of cancer research. Thanks to ATRA, among other things, a large dose of vitamin A, APML patients have an 80% chance of going into full remission after the first rotation of chemo and ATRA. For those that do not go into full remission, arsenic is added to the second treatment rotation, and 80% of those individuals go into full remission. 95 out of 100 people, young or old, will hear their hematologist give them the C word at some point down the long road. The C word is, you're cured. So that is why tears of joy flowed on what would become Austin's D-Day. Diagnosed Acute Promyelocytic Mylogenous Leukemia.
My name is Austin. I'm very special. I have leukemia. Leukemia. My